Good morning. I'm here to perform medication administrations. So I will show you my ID. My name is Ibil Luzondas Cabrelius. At the back of my ID is a student ID number, which is 3822292. Now I will show you my right side of my surroundings. This is my right side and this is my left side of my surroundings. So before I proceed, I'm gonna wash my hands or sanitize my hands. So I will show you my doctor's order here and together with the scenario. So this is the front page, and then at the back there's no rating to show you that there is no rate at the back. And this is my MAR administration record, and then this is the back of the MAR. There is no rating at the back. So this is my small paper here for my label later on, and then for my calculations. So there's no rating here. Look. So now I'm gonna proceed. So I will highlight my scenario. So I am the practical nurse learner for caring Jerry Cofferfield, and I am tasked to administer the medication at 8 o'clock. So I will now verify the doctor's order. Bubali College Hospital, MRN number 5429873. Room number is BBC 408. Patient's name is Copperfield Jerry. Date of birth 1962 September 18. Then sex is male. Physicians Anderson Lewis, and the allergies is peanuts. Primary diagnosis is bacterial pneumonia. Medical history is B12 deficiency, alcohol abuse. Weight 78 kilogram. His height is 183 centimeter. Goal of care is M1. All clinically appropriate medical and surgical interventions directed at cure and control of conditions are considered, excluding the options of attended life-saving resuscitation followed by ICU care. The physician's order dated and timed, it was yesterday, December 7, 2020 at 1300. So the order as follows: clindamycin 300 mg intramuscular every 8 hours, metoclopramide 10 mg subcutaneous every 8 hours, 1 hour prior to antibiotic, cyanocobalamin 50 microgram intramuscular daily for 5 days, heparin 2,500 units subcutaneous every 12 hours daily, thiamine 100 mg intramuscular daily, dimenhydrinate 50 mg per hour every 2 days, PRN, diphenhydramine 25 mg per hour every 6 hours for RAS, PRN, signed by Lewis Anderson. Now I will verify my mark against with the doctor's order. So Copperfield Jerry is the name of the patient, male. Hospital number is 5429873. Date of birth is 1962 September 18. So the medication is clindamycin, 300 milligram IM. Or intramuscular every 8 hours. So in the doctor's order is number 1, the first order is clindamycin 300 mg IM every 8 hours, and in the MAR is the first two, clindamycin 300 mg IM every 8 hours. So now I'm done verifying the doctor's order, and in the MAR I will verify now the allergy, which is his allergy for peanuts. Now I will check now the package of the medications together with the expiration date. So this is the clindamycin injections, 150 milligram per ml, and then the date is here. The expiration date is August 2025. So clindamycin injections, 150 milligram per ml, and then the expiration date is August 2025. It's here. All right. Okay. Now I will gather my materials that I need. So this is my vial, and this is my syringe. I choose 3 ml syringe, assuming this is not yet open. So this is open because I practiced earlier. So this is the package. The expiration is 2024 July 31. So I have also here the blunt filled syringe. Assume it's not yet open. This one, the blunt filled syringe. The blunt, not syringe, I mean the blunt filled needle, I mean. And here, this is the gauge 23 needle. So my availability, my available is gauge 23, but you can also use different gauge from gauge 18 to 27 for intramuscular injection. So but I do have here gauge 23 needle. So I do have here the alcohol swab, and I have the sanitizer, I have the clean gloves, I have a medication tree. So assuming this is my sharp container. So I do have also here plaster, and then the cotton swab that I will use this one later on. So now I will do this one, the what you call this, the plaster here. So I will open this one then for the for later on. Okay, so I'll put it here. So where is the sorry. So now while I'm waiting for this, so after I'm gonna gathering my materials, so I will do my first check together with the MAR and then the medications. So this is my MAR and then the medications here. So first check right medication, right patients. So right patients is sorry, this is not my MAR. So this is my MAR. So this is my mark. So right patient is copper Jerry, Copperfield Jerry, and then right drugs is clindamycin. Right dose 300 milligram. IM or right route is IM or intramuscular. Right frequency is every 8 hours. Right date and time is December 8, 2020 at 8 o'clock. Then right frequency is every 8 hours. The right reason is for bacterial and pneumonia infections, and then right documentation. So that's my first check of my medications. So now I will calculate my dose. So I will grab my blank paper here, small paper here. So the dose, the formula is D over H, or drug on hand, the desired dose. I mean, D over H. So the D is desired dose, and then drug on hand is for each. So times volume equals. So the desired dose is 300 milligram. And then the drug on hand available is 150 milligram times 1 ml. So milligram, you have to cancel it. 300 divided by 150 is 2. So 2 times 1 ml equals to 2 ml. So this is my dose. So 2 ml that I will withdraw later on to give injections to the patient. All right. Next is, so I've done checking my first check. I've done my calculations. So I am ready to give my medication, prepare my medications to the patients. So I will wash my hands. Okay, so I will open my vial now. Okay, here. So assuming that as I mentioned earlier that this is open yet. Before that, before I will forget, I will swab my my vial. So this one with the alcohol swab in at least 30 seconds in a circular motions here. All right. So okay, so I will grab my syringe. So assuming it's not yet open, so I will open this one like a banana peel, like this, right? And then I will grab, and then I will get this one, and then I will pull the plunger to loosen the plunger or the syringe. I mean, okay. So this is it. Okay, I will return to the package. And then I will open my blunt-filled needle. So assuming it's not yet open, so I will open this one like a banana peel. Like this, right? So I will grab my needle, my syringe, I mean. All right? So I will attach my needle to the syringe, so maintain sterility. So this one, here. So now, This is my needle with the blunt filled syringe. So I will withdraw or extract air for 2 cc. So this one here, this is 2 cc, right? So I will extract air. Okay, here. So this is 2 cc air. So now the air, I will introduce this one or inject this one to the vial. So I will open now the cup. Okay, so I will inject this one here. Okay, and then I will inject the air towards the vial. Alright, so now I will make it sure that the bevel, is, I can see the bevel here. Alright, so now I will withdraw I withdraw the medication. So as you can see, the plunger is moving without touch, I didn't touch. So now he is stopped. So I will assist now the plunger to make more to withdraw more medications. Here. I just want to make it sure that I'm in the right, because I cannot see properly the lights here. Okay, here. I think this is it. So now I will remove. Okay. Now I will recap the needle as a laboratory protocol. Okay, I will recap this one. Alright, so now I'm gonna change the needle to gauge 23 that I'm gonna use. So I will open this one, assume it's not yet open. So I will open like this, right? Like a banana peel. Alright, so now I will remove the needle, the blunt-filled needle. And then I will discard to the container, the sharp container. And then the syringe with medications, I will attach the gauge 23. This one. So now, I will check the syringe if there's bubbles. If there's bubbles, you have to tap. Okay, so there is no bubbles here now. Alright, so now I will, I will prime. Alright, so now, this is 2 ml. As you can, I hope you can see in the camera, this is 2 ml. Right? So I'm done priming. So there's no bubbles already. So this is ready for to give medication to the patients. So now I will do now my second check together with the MAR, the vial, and then the medications in the syringe. Okay, so this is it. So right patient is copper pill Jerry. Right dose is right drugs is clindamycin. Right dose is 2 cc or 2 ml. Right route is intramuscular. Right frequency is every 8 hours. And then right reason for bacterial infections or pneumonia, and right documentations. So that's my second check. So now I'm done second check. So I will now write I will now make a label for my medication. So this is it. So this is my this is the paper that I'm gonna use for label. So there's no written here. So I will grab my pen here. So in the label, I will write the name of the patient. So Copperfield Jerry. Copperfield Jerry. And then the medication, which is clindamycin. And then 2 ml. And then the every 8 hours. The frequency. And then the date is 12/08/2020 at 8 o'clock or 0800. And then my initial is ILC, Luz-Cab, practical nurse learner. So here, I'm gonna attach this one, then I will show you. Here. Alright, so here. So Okay, Jerry Copperfield or Copperfield Jerry clindamycin, 2 ml every 8 hours. The date is December 8, 2020 at 8 o'clock. And then my initial is ILC, which is Ibilson Dascabrius, and then PNL, or the practical nurse learner, my designation. So now I will do now my third check together with this medications in the series with the label, and then with the MAR. So right patients is Copperfield Jerry, right right drugs is clindamycin, right dose is 2 ml, then right frequency is every 8 hours, right route is intramuscular, and then the right date and time is December 8, 2020 at 8 o'clock. And then right reason is for bacterial pneumonia, and then right documentation. So that's my third check. So now I am ready to give medications to my patients. So I will put my series now to my medications tray here. Okay, so I will bring my medication tray, then my sanitizer, my gloves, and then together with my MAR. All right. So I'm gonna knock the patient the door of the patient. Knock knock.
Yes, ma'am.
Good morning, sir.
Good morning, ma'am.
My name is Ivy, sir. So I am your practical nurse learner today.
Yes.
So what I'm gonna do is I'll give medications, your medications, which is injections. It's antibiotic for your pneumonia.
Okay, ma'am.
So is that okay to proceed, sir?
Yes, ma'am, please.
Okay. Thank you so much, sir. So I will verify the patients in a two unique identifier. So, sir, can you state for me your complete name, please?
Copperfield Jerry.
And then your date of birth.
September 18, 1962.
So now, I will do the second check, identifications of the patient. So I will verify them, the MAR with the wristband. So name is Copperfield Jerry. Then male, hospital number, record number is 5429873. Gender is male. Date of birth is 1962 September 18. So the room. Okay, so the room number is BBC 408 physicians, Dr. Anderson Lewis. So now I'm done. I'm done identification. I have 2 identifications for the patients. So now I will assist the patients. So first of all, before I assist the patient, so I will make it sure that I will check the brake, and then lower the rails, and then the bed is up with my what you call this, with my waist level, which is a working height, which is my working height level. And then I will make sure the curtain is closed to make privacy, and then proper drip the patient. So now I will assist the patient. So sir, do you have any allergy for your and food?
Yes, ma'am. Peanuts.
How about the drugs?
No, ma'am.
Okay, sounds good. So sir, after that I will choose a site for the medications, injection site. So for IM through intramuscular, so which is antibiotic, then 2 ml, I will choose the glotubentral. So from my hands, I will look the greater trochanter. From greater trochanter using this one, my index finger, it's here. So the greater trochanter, so this one, this is the site of my this is the site of my injection site later on. So I will ask the patient, sir, can you do a rollover to me in a prone position, please?
Yes, ma'am, please. A minute.
So assist the patients in a comfortable positions.
Okay.
Then properly drip.
It's okay, ma'am. Like this.
Okay.
It's okay like this?
Yes, sir. Are you comfortable?
Yes, ma'am.
Okay. So, sir, is it okay to up your shirt and down a little bit your pants?
Yes, ma'am. Okay.
Okay. So this is it. Properly drip. So expose only where you use the site. So greater trochanter. So you have to find the greater trochanter. It's here. 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 Now, so using my thumb here, this one. So this is my side, or this is my side here. So my index finger here. So this one. So this is my side. This is the greater trochanter here. So here. So this is the side. Right? So now I will assess the patient's skin. So the area of the injection site, there's no rashes, there is no bruising, there is no, what you call this, there is no redness, I mean. And then he has a mole, skin color, discoloration, something like this. So that's his normal skin color. So he has a mole here, like this, and then here. Now, the skin is intact. So now I will assess the muscles of the patient if he's really fatty or tiny. So that's my assessment for my patients. So now I will do my gloves. I will before that I will wash my hands. All right. So I will put my clean gloves, I mean. So, use in the IM injections, you have to make your non-dominant hand will make a taut or stretch tightly the skin, and in the dominant hand, I'm gonna wear my syringe. I'm holding my syringe. So, sir, is it okay to put my my medication tray at your back?
Yes, ma'am. Okay.
Are you sure?
Yes, ma'am.
Are you comfortable with that, sir?
Yes, ma'am.
Okay. So now, so my finger here, this one. Okay, so here. Just greater trochanter here. Okay, here. So this is my side. So I will wipe this one. So I'm assuming this is the skin already. Okay, this one here. Okay, so I will wipe this one with the what you call this alcohol swab. I allow this one to air in a circular motions and allow air dry. Okay, so this one. So with my non-dominant hand, I will stretch or taut the skin. So this one like this, that one. All right. So I will grab my medications. So with my non-dominant hand. So I will tight this one, taut or stretch the skin. I will do 90-degree angle. Sir, at the count of 3, can you take a deep breath, please?
Yes, ma'am.
Okay, I will poke you now. 1, 2, 3, and then I will poke. So then I will introduce now the medications slowly. So I will push. So push slowly until you will feel that you will feel that your plunger is not moving. So it means you're done administering the medications. So grab the cotton ball here, and then remove slowly the needle here, this one, and then discard the syringe or with to the container, sharp container. So apply slight or gentle pressure to the injection site while giving slight pressure. You have to give health teachings to the patient. Sir, first, if you feel something that you are shortness of breathing and then rashes, so report it right away to us.
Yes, ma'am.
And then any vomiting, nausea, diarrhea, you have to report also.
Yes, ma'am.
Abdominal pain also if you have to report.
Yes, ma'am.
And then do not massage the injection site or scratch the injection site, sir.
Okay, ma'am.
Okay,
Thank
so
you.
after the giving the instruction or health instructions to the patients, so check the medication area, the injection site I mean. So if there's bleeding, so this one there's no bleeding, so you have to put a new one of the cotton ball here, and then put the plaster here. So now remove this one, and then now cover the patients properly. Then this one. Sir, I'm done giving medications.
Thank you, ma'am.
How is your feeling, sir?
A little bit of pain.
Now you can turn around now, sir, in a supine positions. All right, sir. Any questions before I move? Before I go?
No, ma'am. Thank you.
Okay, sir. So I will remove my gloves now using what you call this? I will remove my gloves here. So this is my my left hand. So I will grab the right here, and then the what you call this, index finger under the neck. Sorry. So here. So I will discard. I will wash my hands. So now I will lower the bed, and then lower the bed and then raise the side rails. So drip properly the patient. So provide blanket. So sir, any questions before I go?
No, ma'am.
Do you have any concerns?
No, everything is
So
good.
okay, sir. Thank you. So this is your bell, sir. Then if you need something, you don't hesitate to call us.
Okay, ma'am.
Thank you so much for your thank you so much for your what you call this, for your cooperations, and thank you for your answer, sir.
Okay, ma'am.
All right, so now I will do now my mark. I will sign my now mark, so I will grab my pen. So I will sign my mark here. So my initial ILC, then PNL. The date today is December 8/08/2020. So I will show you my mark. So this is the clindamycin. Clindamycin 300 milligram every 8 hours IM. So this is the 8 o'clock. So here. So the date today is December 8, 2020. So this is my mark. So now I will discard all my materials needed. So that I use. So this is it. So okay, so before I leave, I'm gonna wash my hands. So sir, thank you so much for your cooperation. I will see you later.
Yeah.
And that's all my medications administration's procedure. Thank you very much. Have a nice day.